How to know if you have AIDS. Acquired immunodeficiency syndrome, or what is commonly known as AIDS, is one of the most life-threatening health risks today. Approximately 31.4 to 35.3 million AIDS patients die every year. Being able to detect the virus early may mean saving your life. When we say acquired, it simply means that this disease is developed because of a disease-causing agent, which is HIV in this case. Immunodeficiency means that the symptoms of the disease are characterized by the weakening of the immune system. Lastly, the word syndrome means that the totality of the disease process is caused and characterized by a group of symptoms. In this case, it is the development of different organ failure caused by the decrease of blood cells called CD4 and T cells. CD4 cells and T cells are very important cells as they are the greatest line of defense of your immune system, especially when it comes to HIV. The main problem with AIDS is that the HIV targets these cells to become a virus factory and spread the virus even more. That is the reason why AIDS can be a very dangerous disease. Here are some ways to check if someone is positive for AIDS. 1. Since HIV is the main and only cause of AIDS, the first thing that you have to do is have yourself screened for HIV. Some of the tests that are available are HIV antibody test, antigen test, P24 test, and fourth generation test. 2. According to the Centers for Disease Control and Prevention, or CDC, a positive HIV patient can be identified as an AIDS patient if he or she has one or both of these. First is that the patient has or will develop at least one infection that is said to be opportunistic. The second is that the patient's CD4 cell count is 200 cells or less. The normal range for CD4 count should be between 600 to 1500 cells. 3. The World Health Organization, WHO, has declared 4 stages of the evolution of HIV to AIDS. The last stage is where the indicators of AIDS show up. Some of the said diseases are toxoplasmosis of the brain, a parasitic disease, candidiasis of the esophageal linings, trachea down to the lungs, and Kaposi sarcoma. 4. It is also better that you take note of some of the unexplained disease that an HIV-positive patient might have. Some diseases to watch out are recurrent upper respiratory tract infections, pulmonary tuberculosis, and chronic diarrhea. AIDS can be prevented, but never can be cured. Prevention, like having protected sex, is still the most effective way to get HIV and AIDS out of the way. Ignorance excuses no one, so you must learn how to take care of your body and should be aware of the things that may harm it.